So types of pain, we'll kind of go through these really quickly, but we all can understand timelines and all of the facts that if there's different types of pain, there's going to be different types of way to address it. But we could all name different aspects of pain. Think about those splenic mass dogs, those big hemoabdomens that come in. They look really weak, right? They're not really responding to you. But if you're all distended, right? If everything's not in the right places, and most of those older dogs are already arthritic in other areas, so they're putting different stress on things. Bloats. Bloats are classically painful, right? Everything's all distended and uncomfortable. Fractures are the easy ones. The arthritic dogs and cats are the easy ones to think about with pain. But even your asthmatics or COPDs, right? There's all different areas to work in with pain. It's not just dealing with, arthritic dogs. These are ones that if you're working in an ER setting, you're working with hit by cars, you're working in all sorts of aspects, perioperatively, preoperatively, trying to identify where pain exists. Cancer, obviously a huge issue for pain, and working with that either from amputees or working in the fact that their organs don't feel well, they're all distended and uncomfortable. Cutting things can be painful, and we should plan for that. So signs of pain, okay? I could ask everyone around the room, we can go through row by row, but for sake of time we won't. But everyone can name probably a different type of sign of pain that you would think of, right? And this is just a quick list that we can kind of go through, right? There's all different types of pain, and you need to understand your patients. So instead of trying to look at that cat post-operatively from a spay, right, we'll keep it simple, right afterwards, but if you've done your pre-surgical exam, right, that morning, or you've done one a week before and prepped for vaccines and preoperative blood work, and then that morning you listen to them again, take a minute. Don't be in a rush. Say hi to the kitty, right? Try to be nice to the kitty, right? See what their normal responses are. Because when they're waking up through dexdomitor and ketamine or propofol or whatever we're using afterwards, you don't have an understanding of where they were to start with, right? Get a baseline, okay? They'll all hide in different ways. There's more objective numbers that we can look at, or objective signs, as far as tachycardia, blood pressure issues. So what's the sign of pain that we all see in the operating room, right? They start to move, right? So what's the response there, right? We'll turn up the gas. Well, one of the things we talk about the difference between anesthesia and analgesia, right? So if we turn up the gas, they stop moving, doesn't mean they don't feel pain. You look through the human literature about people that understand or were awake and couldn't move during their procedures and felt it all, okay? Maybe it's not to that point with cats and dogs because of anesthesia, but they're still feeling it. So the surgeon feels better, right? Because they're not moving, so we can get the thing done because we have the next thing to do because we haven't gotten a lunch break because we have to get the kids off the bus, right? But take the time and work with those and get them comfortable, and we'll talk about ways to do that in a little bit. Because as one of my mentors used to say, turning up the anesthesia, all you're doing is turning down the blood pressure, okay? So we're really helping our patients, we're making ourselves better, but not necessarily our patients. There's lots of signs, some are obvious, some are subtle. Start looking at it every time, and you'll understand where things are hiding on you. And again, it always comes down to a good physical exam. Like I said, with those vaccine appointments I used to do, get used to it. All the CCRPs in the room, you guys are used to measuring girth and flexion extension. You can be doing that on every patient. It's a great way to understand what normal is, so you get to understand what abnormal is.